Good morning. Today I'm going to perform the health assessment or physical assessment of musculoskeletal system. So always remember that before entering the patient room, you should prepare already the equipments needed, tape measure, gloves, and then when you entering the patient room, you should greet the patient, then introduce yourself, then you should always provide the privacy of the patient, and you should explain the procedure to the patient, and before touching the patient you should wash your hands. Okay, so let's proceed to have some interview for our subjective data to the patient. Okay, good morning sir, I'm Irish, your nurse for today. I'm going to assist your musculoskeletal system. So before that, I'm going to ask some question. In your current symptoms, do you recent weight gain? Do you experience any recent weight gain?
Yes.
Difficulty in chewing?
Mm.
Joint and muscle or bone throbbing?
No.
In the past history, past problem, past problem for or injuries to joints? In your muscles, bones, past treatment of surgery, medication, physical therapy, exercise, tetanus and polio immunization,
Yes.
diagnosed with diabetes mellitus.
No.
How old at start of your sorry, this is for female. The how old the menstruation started and the menopause. You should ask for that to female patient. Family history of rheumatoid arthritis. Yes.
Yes.
Gout. Yes.
Yes.
In your lifestyle, activities to promote musculoskeletal health, home remedies to relieve musculoskeletal problems, assistive device to promote mobility, smoking,
No.
alcohol or caffeinated beverages, typical diet, drink milk, take calcium, occupation, time in sunlight, routine exercise, difficulty with typical posture, interference with sexual activities, ability to interact, socialize, body image, stress. And so let's proceed to our objective data. So first, should ask the patient to stand, for observe gait for base. Observe gait for base, weight bearing stability, feet position, arm swing, and posture. In temporomandibular joint, inspect, palpate, and test for ROM. In sternoclavicular joint, inspect and palpate for midline location, color, swelling, and masses. In spine, inspect and palpate cervical, thoracic, and lumbar spine for pain and tenderness. Test for ROM of cervical spine. Test for ROM of thoracic and lumbar spine. Test for leg and back pain and measure leg length. In the shoulders, inspect and palpate shoulders for symmetry, color, swelling, and masses. Test for ROM of the shoulders. In the elbow, inspect and palpate elbows for size, shape, deformities, redness or swelling, and test for ROM of the elbows. In the wrist, inspect and palpate wrist for size, shape, symmetry, color, swelling, tenderness, and nodules. Test for ROM of the wrist. Test for the carpal tunnel syndrome. In hands and fingers, inspect and palpate hands and fingers for size, shape, symmetry, swelling, color, tenderness, and nodules. Test for ROM of hands and fingers. In the hips, inspect and palpate hips for shape and symmetry, Test for ROM of the hips. In the knees, inspect and palpate knees for size, shape, symmetry, deformities, pain, and alignment. Test knees for swelling if small amount of fluid present, do bulge test. If large amount of fluid present, do ballotment test. Test for ROM of the knees. Perform McMurray test if client complains of clicking in the knee. In the ankles and feet, inspect and palpate ankles and feet for position, alignment, shape, skin tenderness, and temperature, swelling, or nodules. Test for ROM of the ankles and toes. If there is abnormal findings on your physical assessment, inform the physician or make some referrals.